Let's be honest for a second. Nursing isn't just a job, it is a high-wire act. You are juggling patient care, emotional support, endless charting, and the occasional spilled bodily fluid, all while running on 4 hours of sleep and cold coffee. Whether you are a brand new grad or a seasoned veteran, we all hit that point in a shift where we just need things to go a little smoother. Today, we aren't just talking about textbook nursing. We are talking about the trenches. I'm going to share 5 practical nursing floor-approved hacks that will save your time, your back, and maybe even your sanity. Let's get into it. Our first hack is an oldie but a goldie, and if you work in post-op or the ER, this is a game changer. It's the alcohol pad nausea trick. We've all had that patient who is suddenly overwhelmed by nausea before you can even get an order for Zofran. Here is the hack. Grab an isopropyl alcohol prep pad, tear it open, and have the patient take slow, deep sniffs of it. It sounds like a myth, but studies have actually shown that inhaling isopropyl alcohol vapor can reduce nausea faster than oral antiemetics in the short term. It's perfect for that bridge time while you're waiting for meds to arrive. It gives the patient a sense of control and immediate relief, which lowers their anxiety and yours. Hack number 2 is about protecting your most valuable asset, your back. We are talking about moving patients. Whether you are turning a patient for wound care or boosting them up in bed, friction is your enemy. Enter the burrito or draw sheet lasso technique. Instead of grabbing the draw sheet with just your fingertips, which strains your wrists, roll the draw sheet up tight against the patient's body like a burrito. Then, use an underhand grip, keeping your palms facing up. This engages your biceps and shoulders rather than your weaker forearm muscles. It gives you significantly more leverage and control, making the patient feel lighter and saving you from that post-shift lower back ache. We have to address the elephant in the room, the smells. Sometimes you encounter odors that are so strong they trigger your own gag reflex. When you're walking into a code brown or dealing with a G, I bleed, you need a barrier. This is the Toothpaste Sandwich. Take 2 standard surgical masks, smear a small amount of toothpaste or a dab of essential oil if you have it, between the 2 masks. Put the first mask on, then the second one over it. The minty smell gets trapped between the layers, creating a filter that masks the external odor without being overpowering or getting directly on your skin or nose. It allows you to maintain your composure and provide dignified care without making a face. Hack number 4 is for your mental load. Charting is endless, and forgetting a task is a nightmare. You might print out the standard census sheet, but it's usually a mess of tiny font. You need to make your own brain. Don't just write a list. Draw a grid. Divide your paper into hourly blocks or task categories: meds, labs, vitals, assessment. Use a multicolored pen system: blue for routine, red for urgent/stat, and green for done. By visualizing your shift as a grid rather than a list, you can see white space where you might have time to eat and dense space where you need to ask for help. It turns chaos into a manageable schedule. And finally, number 5, the spaghetti monster of IV tubing. When your patient is ambulatory or confused, those lines end up everywhere. Here is the hack. Don't just let the tubing hang. Loop the excess tubing into a neat coil, about the size of a saucer, and tape it loosely to the patient's gown or the bed rail with a piece of paper tape. This creates a strain relief loop. If the patient pulls, it pulls on the tape first, not the IV site. It saves the IV, saves you a stick, and keeps the floor clear of tripping hazards. Nursing is hard work, but working smarter can make those 12 hours just a little bit easier. Try these out on your next shift. See if the alcohol pad helps that nausea, or if the grid system clears your mind. You are doing incredible work out there, and you deserve every trick in the book to help you get through it. Stay safe, scrub in, and I'll see you in the next one.